Well, hi. All right. I think you might be muted. Well, thanks everyone for coming today to our Zoom chat about medication basics. I appreciate everybody signing on. I know that these times are a little bit different, and I certainly do miss seeing everybody at the live classes at VMRC, and hopefully in the next few months we'll be able to start that back. So what we're doing today is we're going to cover medication basics, and this is part one. Next week, on Thursday, we'll have part two of this. And these two modules are designed to help you to make sure that your whole medication process from getting the medications to giving and monitoring and documenting medications are all what they should be for from a patient safety perspective. So what we want to really do over this week and next week is to increase your knowledge as providers to our consumers when you assist them with medications to do it in the very best way that you can so that we can try to prevent medication errors. One of the things we also realize about you folks is that you're essential, obviously, to the process because you're the ones interacting with our consumers, monitoring not only how they take their medications and perhaps helping them, but also help us to find out if we have any problems going on. And then we're also going to talk about documentation. We'll talk some about that today and also next week, because that's really an important component of helping consumers with medications. When I review incident reports, a lot of them could have been prevented if someone had done the right documentation or shared with the next person coming on the shift that they had or had not given a medication. If they had documented it, then we wouldn't have had some of those errors. So documentation is a very, very important part of this. So we'll be talking a lot about documentation. So when you come away from this talk today, you should have a basic understanding of some of the medication vocabulary that we use when we work with patients or consumers and medications. I'm also going to talk with you about how to read a prescription label, and this applies not just to the consumers you help with, but it applies to all of us when we pick up prescriptions at the pharmacy. What kind of information is on that bottle? It's really can be really helpful to you as a care provider to know how to read a label and where to find all this information, because a lot of the things you need to know in helping them to take the medications or giving them are there. We're going to talk about the rights of giving patient rights of medication administration. Now, I want to tell you up front, this number changes all the time. Every time I give this talk, someone emails me and say, well, there's now an 8th or there's a 9th. So I did a search last night and I actually found one list that was 20 items long. And I think this is getting, it's going too far down that road. We're going to cover everything in these two modules that you need to know about helping consumers with their medications. And if you just follow these principles, you'll be okay. But the current list I have in this presentation is 7, and I think they're the 7 probably most important. We're also going to talk about how to store medications. That's a big deal because the medications don't really belong to you. They belong to the consumer or the patient. Yet you're the one who's storing the medications, and there's some things that you do and there's some things that you don't. So we'll cover that. And then lastly, we're going to talk about medication refusals. That's always a gray area, no matter what environment you find yourself in. For instance, we at the hospital have to deal with medication refusals all the time. And so what are some of the causes of it and what can we do about it? So we'll help you a little bit with that stuff too. Let's talk about what you should know about medications. And I'll preface this by saying, we're not trying to turn you into pharmacists or doctors or nurses or anything like that. But you should have some basic understanding of the medications that your consumers are taking, so that when you know kind of why they're being used, what do I need to look for, those kinds of issues. So just some basic things, and we'll talk about all of these. What's in the name? Well, one of the confusing things about medications now is that there's a generic name and then there's a brand name. Generic name is assigned when the drug is discovered, tested, and approved by the FDA, but the company that did that gets to come up with a brand name. And I can tell you that both generic and brand names are becoming really sometimes just difficult to pronounce. Some of my colleagues at St. Joseph's Medical Center, I was on a call with them the other day, and some of these new drugs, we just give up and say, I'm not even going to try to pronounce that. We're talking about this drug, because some of these names are just very difficult, especially the new biologics that are out there. What do you need to know about what it's used for? Well, again, you're not prescribing it, but you should have some idea of why this medication is being given to your consumer that you're helping. Especially important for you guys is how is it to be given? And there are a number of different formulations, even for the same drug. And so you have to know actually how it's to be taken. How long is it used for? One of the problems that we run into in long-term care type situations is that medications get added to a profile for a specific issue. The issue may resolve and the medication may be left on the profile and the person keeps taking it forever. So we need to talk about, how long is it going to be appropriate to use this drug? Give with food or not? It's another big question that pharmacists get all the time. And a little bit about side effects and drug interactions. Now, before you get nervous about all this, I'm also going to give you resources that you can use both on your smartphone or on your computer. There are sites that you can go to that are very user-friendly, where you can get information about medications. So let's go back to this, what's in a name? Well, again, every drug has a generic name, but the company that makes that generic name gets to give it a brand name. And so those will be different between different manufacturers. So if you take one generic drug, it's made by company A, they have a name for it. And then there might be company B who has a name for it. So you have a generic and now two brand names. So this can get to be very confusing. However, when you pick up a prescription from your pharmacy, they will have the generic name on the label. And so you can always know the generic. In fact, we prefer to use generics over brand names because a lot of times brand names come and go. A company decides, well, we're not going to make it anymore. And so then you don't have that brand name out there. And unfortunately, many of us in the field do learn these things by brand names. And then that's how we sort of refer to them. So I try myself to use generic names. Now, why do you need to know about names? Well, you want to be able to compare what's on the label of the prescription bottle to what's on the medication administration record, or the MAR, as we call it, so that you can avoid making mistakes. So again, I'm going to give you resources where you can look these things up if you need to, but the generic will be on the prescription container that comes from the pharmacy. Let me kind of take a little bunny trail here just for a minute. I get a lot of questions from patients about whether or not they should take generic versus brand names. To some extent, you may have a choice, but to a large extent, you probably don't, because brand name products are almost always more expensive than generic products. And so your insurance company may, in fact, set limits on what you can have. And it may be that you can only have the generic unless you want to pay for it or you want to pay a higher copay, because sometimes in these insurance companies, they have tiers of medications. So it may not actually be something that you and your pharmacist can decide, well, we're just going to do it unless you're willing to pay more money, because a lot of times insurance companies max out on what they'll pay for. And that means that's what they'll pay the pharmacist to fill the prescription. And pharmacies have to have some profit or they can't stay in business. So it can be difficult. Now, what do? I'm comfortable with generic medications. My family takes medications and we get generics, and we have no problem with that. Now, sometimes there's some really critical medications, we call them narrow therapeutic index medications, where the blood concentrations need to be within certain limits, or the dose has to be within a very narrow limit, so you have effectiveness without too many side effects. Some of the things that come to mind where there's been conversations about generic versus brand are the anti-epileptic or anticonvulsant drugs. There's a lot of controversy about those because there's been some indications that perhaps people who are switched from a brand name to a generic may not have the same response to it. But in general, most people feel that generics are fine for most indications that we get prescriptions for. So as I said, I have no problem myself taking generic medications. Now, what do we mean about the indications for a medication? And indication in this perspective is a very specific word. What that means is that a drug company has made a drug, made a medication, and they've tested it for certain reasons. So let's take blood pressure, for instance. So those drugs are called antihypertensives. So the company will develop this drug and they'll take it through the various phases of clinical trials to bring it to market. And they do those trials eventually in patients who have high blood pressure or hypertension. And they demonstrate that this drug does in fact lower blood pressure. So the FDA approves this drug for the indication of hypertension or high blood pressure. Now, drugs can have several different uses. So, for instance, in my field of psychiatric medications, you might see that the drug quetiapine, which is Seroquel, is indicated to treat schizophrenia. It's FDA indicated to treat bipolar disorder. It's FDA indicated or approved to also help treat depression. So a medication can have more than one approved FDA indication. Now, doctors or prescribers, I should say, any prescriber may use a medication in what we call an off-label fashion. That is, for something that the FDA has not approved the drug for. But there's a higher standard to that, and it generally requires that in that field, whether it's cardiology or whatever, in that field, clinicians are using this drug for that reason. And so it's perfectly legal for a physician to write a prescription for medication for unapproved or what we call off-label indication. But again, the risk for them is a little bit higher because they're using it in an off-label fashion, but that can be done. But what you need to know for sure, I think, is, what's this drug being used for, just in a general sense. So if you got a patient who's taking Divalproex, the brand name is Depakote. Well, is he taking it for epilepsy or is he taking it for bipolar disorder? You probably should know that. And then you should also know something about dosing, even though you're not writing the prescription or anything like that. But you should have some idea, again, of is this dose really, really high? Because if it is, then maybe you're going to anticipate more side effects or something. And again, don't worry about this because I'm going to give you some resources where you can check these things out. Most of the time, physicians write these medications within the appropriate FDA-approved dosing range, and you don't have to worry about it. Now, also, it is really important, obviously, to know how a drug is supposed to be given. The most common way is obviously by mouth, whether that be a tablet or a capsule. But then there are some things that we take by mouth that are not swallowed. So for instance, we have what are called orally disintegrating tablets. So that's an oral formulation or preparation, but it isn't swallowed. It's some are placed on top of the tongue. Some of these are placed on under the tongue. Some are placed between the cheek and the gum, where they dissolve, and then they're absorbed there because that's a highly vascular space. So just because it's oral does not mean that it's going to be swallowed, and you need to know the differences between these medications. And again, that's going to be on the label of the prescription. But we have a variety of ways of getting medications into the body. There are many medications that are inhaled. There's obviously, some people use those little meter dose inhalers or the dry powder inhalers, those kinds of things. Some of the drugs your consumers take are injected. The big one there is probably insulin, which is given subcutaneous. Medications can also be given rectally, and that's important in our consumer population because sometimes, because of their disabilities, they may not be able to swallow medications, and we can actually give many of the medications rectally. As I said, there are preparations that are dissolved under the tongue. There's some, obviously, there are a lot of things that go on the skin, creams and ointments, but we also have patches we call transdermal patch formulations. There are estrogens that come that way. There's some blood pressure medications, or one anyway, clonidine comes that way. So there are a number of these different ways that you might be called upon to help a consumer use a medication. It's important to know the proper way to do it. Now, when you hear us pharmacists talk about a dosage form, what is it that we mean? Well, we're talking about how does it come? Does it come as a capsule? Does it come as a tablet, a liquid, or these various things on the slide? There are a lot of medications that are given inhaled, whether it's in the nose or through the mouth into the lungs, etc. But one of the points that I want to make here about these different preparations is a lot of our drugs, a lot of medications you give consumers, you may be giving them an oral capsule or an oral tablet, and they have trouble swallowing. And I get a lot of questions from service coordinators on this, and people forget that it may be that that medication can already be gotten as a liquid preparation. So if you have someone who's having trouble swallowing and they have a problem getting tablets down or something, let your pharmacist know, or the physician, or you can email me and I can tell you, I can look up for you and tell you, yeah, there is a liquid, and then you would ask the prescriber to change the prescription to that formulation. And then with tablets, of course, some tablets are really large and it can be difficult for anybody to take. And if that's the case, talk to your pharmacist, because there may be alternatives out there that we could help them with. Now, here's another important point that I made, and that is, well, how long is this medication supposed to be given for? And here, the way I like to think about it is, well, what is the condition? Is it something that's short-term? We call those acute problems. So let's say it's next winter and the consumer gets an upper respiratory infection, maybe bronchitis or something like that, and the physician prescribes, I don't know, a Z-Pak or something like that. That short-term acute problem, the medication is going to be given for that, and it's going to be given for a specified period of time. For most infections, it's usually a few days, maybe 3 to 5 days. For urinary tract infections, maybe longer for respiratory tract infections, but there'll be some specified time frame within which that's supposed to be taken. And so when the problem has resolved, then the medication is stopped. Now, in our consumer population, another issue that we'll see is that the consumer maybe is stable, kind of doing okay behaviorally. Something happens that disturbs them, or they don't like change or whatever, and they start acting out and having behaviors that are not responsive to some of the behavioral interventions we do. Then a lot of times we'll see a medication added to the regimen. And so what we'd like to do is get them through this problem time, and then when it resolves, be able to stop that medication. But unfortunately, a lot of times the problem gets resolved and people are afraid to stop the medication and see if they still need to be on it. And I understand that, I get it, because these behavioral things can be really disruptive to your care environment. But for some of these where, they were doing fine, something happens, now they're not doing fine, and we can't solve it behaviorally, and we give them, say, an antipsychotic, good practice down the road might be, when they're stable again, to at least consider trying to taper the dose and see if they do okay and they don't have to remain on this medication. So medications for acute illnesses are for short or defined periods of time. Others for chronic conditions, if it's asthma or diabetes or hypertension, these medications are going to stay on probably forever, because they have this chronic disease that needs to be treated with that medication. A really common question I get all the time is, do I take this with or without food? And there's some that have to be taken with food. So if you're taking ibuprofen, the over-the-counter name is Advil, and there's some others. That's called a non-steroidal anti-inflammatory drug, or NSAID. There are a number of these that are available over the counter. You should be taking those with food in your stomach, because these drugs can reduce the mucosal protection in your GI tract and make them more vulnerable to attack by the acid that's in there. So you really want to take your your ibuprofen, your naproxen, those non-steroidal type drugs with food. There's an antipsychotic called ziprasidone. The brand name of that is Geodon. Has to be taken with at least a 450 or 500 calorie meal that includes some fat in it for it to be absorbed. If it's not absorbed, it doesn't get in there, it doesn't work. So, and then there's other medications that are taken on an empty stomach. There used to be some antibiotics, there still are some antibiotics that we prefer to take on an empty stomach. And then for the majority of drugs, it really doesn't matter, to be totally honest with you. So here's the deal. Here's how you can know this. Pharmacies will always put what we call an auxiliary sticker on the bottle when they dispense the prescription. So you look on there and it'll say, take on an empty stomach, or it'll say, take with food. If it doesn't say anything, it probably doesn't matter. But you will always, your pharmacist should always tell you, take this with meals or take it on an empty stomach. Then I get the question, well, what does an empty stomach mean? And generally what I tell people is an hour before, 2 hours after you eat is generally going to be empty enough to do what we need. Now, I'll also make a point that besides the stickers on the bottle, what we call these auxiliary stickers, when we pick up our prescriptions today, there's paperwork that comes with them. I just picked up mine and my wife's prescriptions the other day at the pharmacy, and each bag had printouts that went with those prescriptions. I know what most people do with that. They don't read them. But I would really recommend for your consumers anyway, when those new prescriptions come in for them, that you pull that paperwork out and take a look at it, because it will also tell you, this is how you take this medication. This is also a good source of information about what are the common side effects, what do you do if these side effects happen. There's a lot of good information in those handouts that many people just leave in the bag and throw away. But anyway, you can always ask your pharmacist, and you can call any pharmacy and tell them I'm taking this, and they'll tell you how to take it. Now, what do we mean by side effect? Well, that's obviously it's an undesirable effect of the medication. And sometimes they're predictable from the pharmacology of the drug. So for instance, many of us might take over-the-counter Benadryl, which is diphenhydramine. For allergies, many people use it for sleep. And the reason it's an antihistamine, and the reason that we use it for sleep, which is obviously not an allergic condition, is because that drug causes drowsiness. So drowsiness is a side effect. And when people take it for sleep, they're actually just taking advantage of that side effect. What I recommend for care providers is when you have a few moments of time, take a look at the MARs, or the med administration records for the consumers you're caring for, and just use one of these resources I'm going to give you, or the paper that came with the prescription, and get an idea of what the common side effects might be. And the reason I'm asking you to do that is that you're the frontline person with this consumer, and some side effects are subtle, or the consumer may not be able to verbalize what he or she's experiencing with this medication. And if we have you there kind of knowing what could happen and watching for it, then we'll get a better idea when it does, if it does happen. So that's why I'm asking you to take a look at medications. And you don't have to do it all at once. Just you're caring for these people day after day. Occasionally look at the MAR, look up another drug, see what it might cause. Now, what do you do if you think a consumer is having a side effect? Well, obviously you want to document it so that it's in the record that you've noticed it. And then you want to tell their physician or whoever prescribed it, the care provider and the service coordinator. And then one of the things I like to recommend, and they can follow up on this and make sure that the appropriate treatment is given. But one of the things I recommend is also that you let the pharmacist know where the prescription came from, because we have profiles on all of our patients, and we can put in there that this medication caused this problem for this patient. And, the physician may or may not stop it, but we can at least monitor if it's ever used again and alert the prescriber that this person has a problem with this medication. I'll give you an example for myself. I can take ibuprofen, and I have no problem with it. But if I take naproxen, and both are over the counter, if I take naproxen, after a couple of days, I get this gnawing pain in my stomach. And so I really don't tolerate naproxen. So that should be in my record because it's a commonly prescribed drug in addition to being over the counter. So I like to recommend that people let their pharmacist know. Now, a little bit about drug interactions. I don't expect you to do a lot with drug interactions, just know that they can happen, and that our consumers are at risk for it because a lot of consumers have more than one prescriber. And in our country right now, we do not have a common electronic database for all of us. So one prescriber will not know what another prescriber is doing unless you're in a closed system like Kaiser or something like that. They, of course, would know. But if you're just a person who has regular kinds of non-HMO health insurance, right now, the situation is that one prescriber will not know what another one is doing. So when you see your consumers getting new prescriptions from another or a new prescriber, you want to make sure that the pharmacy is looking at this. That's why I recommend that people use one pharmacy, because again, we have this profile. And if we know what the issues are with you on side effects, or when we add a drug, the profile has all your other drugs on it, it will alert us that there's a potential drug interactions. I use this in the hospital all the time. When my patients come in, I have a drug interaction checker that I just run on their meds because I can't remember. There's thousands of potential drug interactions and I can't remember them all. So there are drug interactions, there are drug food interactions, and there are drug disease interactions. So for instance, giving one drug with another can cause problems. Maybe it increases the level of one drug in the body or it reduces the level or whatever. Foods can affect absorption, but also some types of components of food can impact the way a drug is acting. But also diseases. It's an important thing to remember that some drugs, if you give them to people who have certain kinds of diseases, you can interfere with the control of that disease. So there are a number of things that can happen because of these interactions. So making sure that you go to one pharmacy where all the consumer's medications are listed and on the profile is the best insurance about drug interactions that you can have, because you can know that the pharmacist will be alerted when a prescription comes in if there's a potential problem, and he or she can deal with it. All right, so what is on a prescription label? There are both state and federal laws that require certain amounts of information to be on the label. And over the years, with time, that information has really changed. In my workshop, I actually have a bottle that my father used to put fishing weights in that was a prescription bottle for my aunt for a really old blood pressure medication. And I was looking at it the other day because I'm a pharmacist who collects old stuff, old pharmacy stuff. And I looked at it and it's like had her name and had the drug and had the instructions. And that was like, yeah, that would not happen today. Today's labels include a lot of information. And unfortunately, the fonts are getting smaller so that the older I get, the harder it is to read some of these labels. But as a care provider, you really should know how to look at a label and find out all the information you need. So let's take a look at one here. This is an example that I actually got off of the internet. What you'll see here is that you always have the name, address, and phone number of the pharmacy, always. Then there will also be somewhere on that label a prescription number. Now that's important because that is how the pharmacy stores the record for this prescription and they can find it. And today, of course, that's all electronic, it's on the computer. But that's, if you are going to call a pharmacy about one of your prescriptions, you always want to have that prescription number ready, because then the pharmacist will pull it up and he or she can find out all about the information. You'll also know who the prescriber is. Obviously, you have the patient's name on there, the date dispensed, and then directions are usually in a larger font, so that's easy for anybody to read. Although I will tell you that some people, particularly elderly or some of our consumers, obviously may not be able to read that label. Then you will have the drug, and you'll see here this drug is a atorvastatin. That's a generic name for a cholesterol lowering agent. They'll have the strength, which is 20 milligrams, and then the formulation that we're talking about. So this comes as a tablet. Now, all this is really good for you to know. You have to transfer a lot of this to the medication administration record, right? When you get the prescription, you transfer this stuff over correctly onto the MAR. But here's a couple things that I really want you to watch for: the quantity and how many refills. So if you look at this, it's take 1 tablet by mouth every day. 30 tablets is 1 month. So that should tell you that I need to make sure there's a refill ordered about 3 weeks into this prescription, because you want to give a pharmacy about a week to process a refill, because the physician may not have authorized any refills. We have to fax it to their office. They won't take phone calls from pharmacies hardly anymore. So you fax it over. If the doc's on vacation or off or busy or whatever, pharmacies may not get called back that day on a refill. And I see a lot of event reports filed for people who ran out of their medications because the refill didn't come. And it's not always the pharmacy's fault. It may be, but often it's because we couldn't get the prescriber to authorize the refill. So that's an important number for you to calculate in your head when you get a refill or a new prescription in for a consumer. The second thing is down here, you'll see this blue REF. That means how many refills are left. Now, the reason that's important is because if there are refills left on your prescription, that means they don't have to call the prescriber. The prescriber has authorized a certain number of times this can be filled. If you see that the refills are 0, then again, that means they're going to have to contact the prescriber. You're going to give them plenty of time to do it, because the most common reason for event reports for consumers missing medications because they didn't have the refill is that it wasn't ordered soon enough. So that's critical. Now, another date we'll talk about is the expiration date. Drugs are produced by manufacturers, and when they come out, they have a certain window within which they retain at least 90% of their stated potency. So if you have a 10 milligram, well, let's say you're looking at this, it's 20 milligram tablet, okay? So it would have to maintain 90% or more of that 20 milligrams. So at least 18 milligrams of potency has to be there, because drugs in tablets and capsules begin to degrade with time, obviously. That's why these expiration dates are on there. And why do I say you need to watch that? Because some of these medications, particularly those that are taken on an as needed or PRN basis, may sit around in that person's med tray for a long time and not be touched. And the expiration date passes, and obviously you can't give the medication. So always pay attention to how much time you have left before that drug expires. Last thing about this label on the right side is what I was telling you, we call those auxiliary labels. They can be different colors. They can look different than this, but see, there's information there. For atorvastatin, we prefer that people not eat or grapefruit or drink grapefruit juice, because it can affect the levels of this drug in the body. And also, this drug can be an issue for women who are pregnant. So they tell you basically, if you're pregnant, make sure your physician knows about it so they can take proper precautions. So that's how a label looks, and you can get, as you can see, a lot of information off of that. Okay, so here we come to the rights of medication administration. I'm only listing 7. I know you can Google this up, because I did it last night, and you can find a lot more than 7. But here's what I think are the core issues, okay? You have to make sure you've got the right person. I still get event reports where medications are given to the wrong person. Most often it happens for one of 2 reasons. First, there are too many, you're working on too many consumers' med cups and stuff at one time. You should do one person, get it over with, go to the next person. The second common reason is you have too many people crowding around you. You're trying to do this med administration thing, and there's people all around you, and it's too distracting, and you're hurrying through it, and all of a sudden you make a mistake. So those are the 2 most common reasons for not the right person. So always make sure. Now, you're caring for them all the time, so you know who they are by sight, you know their name. In the hospital, we have nurses. If you're in the hospital, the nurse will ask you your name, and then he or she is going to ask you your birth date, or they may ask you to show them your admission bracelet or whatever. Make sure it's the right medication. Okay, so consumers may have more than one medication. They have more than one prescription bottle. And at 9 a.m., this one is due, but you accidentally grab this one. I see event reports about that too. So just make sure you're taking the time, look at the MAR and say, okay, these are the medications that I have to get ready. Make sure it's the right dose. Here, I don't mean so much for you guys that you have to worry about is this 250 versus 500 milligrams. But one of the things you do have to watch for is it one tablet or two tablets, one capsule, two capsules? Is it one spray for the inhaler versus two? So make sure you're giving the right dose. Make sure it's the right time. So again, the MAR is critical for this. Like your medication administration record will have the times on those columns of when it's due. The right route of administration. Most of the time, this is obvious, but there's some of those nuanced areas, like maybe it's an orally disintegrating tablet, so you're not going to tell them to swallow it. So make sure you know what the preparation is, how it's supposed to be given, the right reason. This mostly applies for as needed or PRN medications, because scheduled medications for heart failure, you're going to assume that this medication is being given for the correct reason. But if you're giving it on an as needed basis, then obviously you have to know the reason to know whether it's time to give this drug or maybe it's another drug. So knowing the right reason. And then lastly, right documentation. Now, I saw an error this week in my hospital. It's a classic error of med administration. The person was getting medications ready in the little cups, and instead of waiting until after she went and gave the medication to chart that it was given, she charted that it was given, then she went out, the patient refused it, and she forgot to unchart the medication. That's a classic. So we ask that you not chart that it's given until it actually is given. And then you go back and you put it on the medication administration record. So again, you can find more than 7, but I'm just telling you, if you do everything we're talking about in this module and the next, you're going to be fine. So again, how do you know about the right person? Well, you compare the name on the label to the person you're looking at that you're going to give the medication to. Is this the right person? And is it on the MAR? So personally, I look at the MAR, I look at the medication, and I look at the person. If those 3 things line up, I've got the right guy. Right medication, again, you should compare the name on the bottle you pick up to the MAR, and that is for that time where it shows this is to be administered at this time. Compare that name to that name. They should always match up. So should the dosage form. If there's any difference on there, you should ask why, okay? Another little bunny trail here. When we talk about generics, and there are different companies that make generics, those things don't always look alike. And so I take one blood pressure medication, and my pharmacist changes brands to help me get the best price. And sometimes they don't always look the same. And if you don't know that about that ahead of time, you open up the bottle, that can be kind of frightening, because first my tablets were a little bit large, and then I picked up a refill one day and got home and they were small. But then there was a note in my bag from the pharmacist, hey, Bill, I had to change brands. So I sort of knew. So anytime there's a big difference, if you're uncomfortable with it, call the pharmacy. If they don't tell you, hey, we had to change brands, this may look a little bit different, then you can take care of that and it won't bother you. And again, the right dose. Here, mostly for you, again, I'm not concerned that you know how much Depakote to give for epilepsy, but I want you to be aware if there's going to be 1 tablet or 2 tablets or 1.5 or whatever, and you check, again, the label against the MAR, knowing that drugs do come in different strengths, and sometimes we have to give a half tablet, sometimes we have to give a whole tablet. The right time. Again, if I were you, and you're responsible for helping with med administration on your shift, I would look at the MAR when I come on, and I would probably make some notes about, I've got meds to here, here, and here. So you always want to check the med administration record so that you know when your consumer is going to have medications due. This is another source of errors that I see when I get the SIR reports, is that somebody forgot to look at the MAR and didn't realize, oh, his Zyprexa was due, at bedtime or whatever. You try to give them as close to the time as possible, but this is another thing I get a lot of questions on. What happens if I'm an hour late? Most of the time, it's not a big deal. There are very few drugs that it's really critical that it be given exactly at that time. So we usually try to say within 30 minutes to an hour of the time that it's due on the MAR. So it could be 30 minutes to an hour before if you had to, or 30 minutes to an hour after. It depends on your policies at your facility. We have policies at the hospital that we follow. But I see a lot of event reports where somebody was late giving medication, so they called the pharmacy and then they called the doctor and all this stuff. And almost always the doctor said, well, just take it now, but whatever. But if you have any questions about that, if a med is missed, call the physician's office or call the pharmacy. Most of the time the pharmacist can tell you what to do. But here's another kind of quick way to know if timing is really important. Let's take a drug that's given 4 times a day, okay? If the physician writes the directions as take 1 tablet 4 times a day, generally that does 4 times would be every 6 hours, right? But when they give the instructions 4 times a day, that generally tells the pharmacist that they don't mean that it has to be exactly 6 hours apart. What it means is that roughly evenly spaced, but you don't have to get up in the middle of the night to do it if the directions are 4 times a day. On the other hand, if timing is critical, the physician will write the instructions as take 1 tablet every 6 hours. And in that situation, we generally try to be pretty precise with when they give the medication. Although here again, 30 minutes either way is probably not going to make a big difference. So if you have any questions about timing and those kinds of things, just call your pharmacist who filled the prescription and he or she can tell you what you need to do. And we've already talked about the right route of administration. Most often it's really obvious. You either got an inhaler that you inhale or you have a tablet that you swallow. But then there are some differences. Like I said, there are these orally disintegrating tablets and some of these things. So just make sure you know how to give that preparation. Right reason. So normally, as I said, for those scheduled medications, you're going to give it anyway because it's scheduled. So if you have an idea, well, this is, let's say it's hydrochlorothiazide, which is a diuretic, that's probably going to be given for blood pressure, but it's going to be given on a scheduled basis. It's more critical for you on the PRNs or as needed medications because you simply must know what the person's complaining of and do I have an order for that? So let's take an example. You have a patient who's taking diphenhydramine or Benadryl, 25 milligrams twice a day for allergies. And you know that over-the-counter Benadryl could be used for sleep, but that's not what it's ordered for your consumer. It says twice a day for allergies. And if the consumer tells you, wow, I can't sleep, maybe could I take one of the Benadryls for sleep? The answer to that is no, because that's not what it's prescribed for. So you need to know really the reason. It has to be clearly stated on the MAR. For all your PRN or as needed orders, need to have very clear instructions on what it's for and when it can be given. Now, we've talked a lot about the MAR, and it's central to your function in helping consumers with medication administration issues. So one thing I would say up front is that the format of the MAR is not dictated by anyone, but the information that is to be recorded in the MAR is dictated. So you can have different forms of MARs, and that's okay as long as they contain information that's required by regulation, okay? So the things that have to be on there are obviously the drug name and the strength, the prescriber, how it's to be taken, how many times a day, or how many hours apart or whatever, how is it to be given, and then any instructions on the auxiliary labels, I suggest that be put on the MAR. So for instance, if you have a consumer who's taking ibuprofen, you'll probably see on the bottle an auxiliary label that says take with food. I would put that as a notation on the MAR to remind everybody when we give this ibuprofen, we'll make sure that it's given with food. So these are the critical things that have to be on your MAR. Now, there is an example MAR that the state of California has in some of their manuals on medication management of our population of people. And if you want to see that, you can look it up, or you can send me an email and I can send you a link that you can look at for an example medication administration record. Now, another thing that you don't do is you don't use unapproved abbreviations, okay? So don't invent things yourself. Document what you did, document what time you gave it, put your initials on there and all that sort of stuff. And then also on your MAR, when you have, I like to see scheduled medications, and then I like to see the PRNs in some other place so you don't get mixed up and give those PRNs on a scheduled basis. So you should make sure that those do not have times scheduled. So if it's Benadryl twice a day as needed for allergies, you wouldn't have times posted out there on those columns because somebody could misread that and give it. So never, ever, ever give medications without looking at the MAR, reading through it, making sure you understand exactly what you're doing and that it's correct. So when you are using the MAR for med administration, there's going to be a place where for that date and day and the time the med is given. So when you do that, your facility will have a policy, but in general, by that time, you will put your initial, and that means that it was given. And again, you don't sign ahead of administration, you wait till you actually give it. And you never erase on a record. If you make a mistake, you make one simple correcting line through it, put the correct information down, and then you can even write the reason you're correcting it if you want. But you don't ever erase on a MAR. And then if you're giving a PRN medication, make sure you document on there, it was given at this time for this thing. Some medications actually require you to take a look at certain vital signs like blood pressure or heart rate. So for instance, there's a heart medication called digoxin that slows the heart rate down. A lot of physicians will write an order, digoxin 0.125 milligrams once daily, hold for heart rate less than 60. So what that means is you would have to take the pulse before you give the medication, make sure that it's above 60, or you would hold it and you would document that on the MAR, held because blood pressure or heart rate too low. And some blood pressure medications may also include hold for blood pressure lower than whatever. So if those notes are in the orders, then you make sure that you monitor those before you give the medication. All right, let's talk about some steps you can take to avoid some of the errors that I've talked about. So one of the things I suggest is first is that you get a place where you're not distracted. So you don't want to be out in the living room with the television going and 7 consumers running around you. Find a place that you can be undistracted when you're doing this. Get everything together that you need. If you're using the little paper med cups or whatever it is you do for equipment, get all that together and then start setting up your medications. And you do that by using the MAR or whatever logbook you have, but it's a med administration record. You should wash and dry your hands. That's particularly important today with everything that's going on around us. We just wash our hands thoroughly before we do anything with patients. I never touch a patient's medication without having washed my hands. And then you prepare the meds. Usually there's those little white dose cups. And then you go through the 7 rights, making sure that you've done everything correctly. Is this the right person? Is it the right medication, right dose, right time, right route of administration? If it's an as needed medication, am I giving it for the right reason? So again, if you keep just these core 7 rights or 5 rights here, or 6, in your mind as you're preparing the medication, you're really unlikely to make a mistake. And never rush. Never rush. And back to the distractibility thing, sometimes I see errors made when somebody's doing this preparation and they're doing it really well. And then all of a sudden, something happens, a consumer, loses control of him or herself or whatever, and starts, ranting or whatever it is they're doing. I've seen people get distracted by that and then end up giving medication to the wrong patient. So if that happens, and you need to be involved with helping the consumer, secure the medications so they can't be grabbed by anyone else, secure them, take care of what you have to, and then come back to the medication administration. Don't try to do two things at one time. And then observing your consumer to make sure they actually take the medications. We have issues with some people will do what we call cheeking the medication. They don't want to take it, but they don't want to refuse it. So they put it in their mouth, they drink their water, but the tablet is stored over here in the side of their mouth. They get away from you and they spit it out. So the best thing to do is just ask them to swallow in front of you and then watch them, make sure they're not going away and spitting it out somewhere else. And then finally, you do correct documentation. Now, if they refuse it, generally what we do on a MAR is if that time is listed and they refuse it or it wasn't given, we ask you to circle it, put your initial there, and then put the reason it wasn't given. The circle time usually means it wasn't given. So initial it and then write a brief reason: patient refused, patient unavailable, or whatever it is. So let's talk about those refusals. It does happen from time to time, and you have to remember consumers have the right to refuse medications unless there's very, very specific reasons. We call those, it's called a Reese hearing, where they're found to be incapable of making decisions and they have a conservator, all these things. But far and away, our consumers have the right to refuse medications. And always remember, you can't trick consumers. You can't trick anybody about taking medications. You can't hide it in their food, those kinds of things, okay? They have the right to refuse. Now, what should you do? Well, you can ask the consumer, well, why? Sometimes you might get good information, like they might be able to tell you, this upsets my stomach, or this tablet's too big, I can't swallow it. Or whatever. So sometimes you can find out things that are actually correctable. From time to time, I get notes from service coordinators saying they just can't get this person to take his or her medications because he can't swallow them. What can we do? And I look up and find, well, it's available as a liquid, and I send them a note back saying, have the doc change it to the liquid preparation. But if they refuse, go ahead and note that on the MAR. You don't just walk away from the MAR like nothing happened. You have to record on the MAR that they refused it. As I said, generally we circle the time and initial, and we'll put down the reason. But at that point, refusing one medication is one thing. Refusing it consistently is another. So when medication refusals are happening, you really do need to alert somebody. First person I would go to, if I were you, is I would notify the care home administrator, and he or she can make the decision of whether the physician has to be called at that point or not. But certainly whoever is prescribing and taking meds and taking care of this patient needs to know that they're refusing these things. Lastly, let's close up with some tips that I think if you follow will really help you to avoid making some mistakes. So never use a medication that's from an unlabeled bottle, or if you can't read the label, okay? Because that means basically you're not sure what you're giving. I've had so many people come into the pharmacy to show me their medications, and I look, and there's 3 or 4 different medications in that bottle. That's a prescription for a disaster, because unless you're absolutely certain, oh, the blue one is this, the red one is this, etc., that's going to be a problem. So never mix medications, and only a pharmacist can label a bottle. So you can't take a bottle of, say, 100 ibuprofen tablets prescription and then pour some into a bottle and label it and send it home with the person. That's against regulations. So just don't use unlabeled bottles. Pharmacists can label for you. They can give you other labels, other bottles are labeled for transfer of medications if that's appropriate. So avoid mixing medications in the same container. When a doctor stops or changes the way med's used, make sure you document that right away. So if your consumer goes to visit a care provider, when they come back, you want to make sure that you know all the changes that were made. I've seen some event reports come back where consumers went to an urgent care or to an ED, or they were admitted to the hospital and they got care, and then they were discharged and they come back and there was a mix up in the information. Well, they were taken off of this drug, but I still had it at the facility and I didn't know that, so I gave it to them. So whenever there's a change in care, they go someplace and they come back, make sure you know what was done and if there's any changes to what's going on with the medications. Also follow all the instructions on the auxiliary labels. For instance, shake well, take with food, keep in the refrigerator, keep at room temperature, those kinds of things. Know the names of the drugs that you're going to give. And as I said, I'll give you some resources on that in a moment. But last there is always check about refills. Number one, make sure you get the refills on time, which means at least a week in advance notice to the pharmacy. And then when they arrive, check to make sure that they match what's on the medication administration record, knowing that the way the tablet or capsule looks may be different because they had to use a different brand. But just again, making sure that it's the correct medication on the MAR. By the way, another sideline here. Sometimes people ask me to identify tablets. Some tablet was found somewhere, a capsule, and they say, well, what is this? You can go online, and if you Google up tablet or prescription tablet identification, something along those lines, there are these checkers that you can use online, and a lot of tablets and capsules have markings on them. And if you put that in, it'll tell you what it is. It may not take a pharmacist to figure that out for you. Okay. So when you get these either new prescriptions or refills, check it against the MAR. If there's any discrepancies, get that cleared up before you move on. Checking the labels regularly for expiration dates. Pharmacists try to give you at least a year on these medications. And of course, that depends on where we got our supply from, et cetera. But we try to not give you what we call short-dated prescriptions. Again, remembering the rights of administration every time you give a med. Know what your consumer's allergies are, and those should be on the chart or the MAR. Keep a reference source of medications, like the printout that you get. When you get these printouts, there's nothing that says you can't have a file folder for that consumer where you store these printouts that came from the pharmacy. And then you have a ready-made resource that you can look back to for these medications. But if not, I have these sites here that I've listed for you. So one is Daily Med, one's Medline Plus, and another is an app called Epocrates. Let me get out of here for just a moment and I will show you what these look like. Okay, so the one I listed, Daily Med, if you follow that hyperlink or you actually Google up Daily Med, you'll come to this site. And let's say you want some information about ibuprofen. Spell that correctly. There you go. And so if you look here, you'll see that it's ibuprofen. If you hit this, I'm not going to do it now, but if you hit this, you get the package information that tells you all the things about it, like dose, what it's used for, side effects, all those kinds of things. So I find Daily Med to be really useful. It's very user-friendly. You don't have to be a pharmacist to know how to use it. Then there's another one called Medline Plus, and this comes from the National Library of Medicine. Again, it's for patients and people who care for patients, not necessarily pharmacists and physicians and nurses. This is a great site to find out about medications, but also look here, there's a column about not only drugs, but supplements. So let's say somebody's consumer is taking a form of supplement. Maybe it's biotin or something like that. You can go to this area of Medline Plus, and you can either do a search for what you're looking for, or you can find it down here, but that's a great source of information. Lastly, this is an online version of what we call Hippocrates, and it's drug information. It's by drug. It'll tell you general stuff like dosing, what is it used for, common side effects, those kind of things. But the cool thing about Hippocrates, if you go to your smartphone and you go to the App Store, you just enter this name, Hippocrates, you'll see that the app is there, and it's a free app. And it has basic drug information about the stuff that your consumer might be taking. So this is one that I trust. It's good drug information that is very user-friendly. Lastly, I didn't put it on here, but drugstore.com, just drugstore.com is another place that you can go to online to find out good drug information. Okay, we'll talk a little bit about drug storage here. Okay, some rules I'm going to give you. The med cabinet needs to be locked at all times, except when you're giving medications. And that's particularly true when there are controlled substances in there, such as narcotics like Vicodin or Norco, those kind of things. You want them stored securely, and you want them in a place that, and the other reason it's locked, you don't want other consumers getting into that cabinet, or children, if they have any children around. So they should be secured. And only authorized staff should have access to that cabinet, okay? And then medications that have to be refrigerated should be obviously stored in another type of bin. Now, your facility may have a dedicated medication refrigerator. Others of you may not. It's not necessary that you have one of these medical grade refrigerators, or necessarily in a separate one, but you don't want your meds stored in there with everybody else's lunch and all that stuff. So even if you do have them in a fridge, put them in a different container, preferably locked or at least secured, so that they're not getting mixed up. You're not moving, ketchup bottles and all this stuff, so you can find the prescriptions. Each person's medication should be stored in their own tray or bin, and they don't have to be expensive things, just a plastic bin for each patient, so you don't have them all mixed up. Have them separated by patients. Now within those, we generally recommend that meds to be used internally are somehow segregated from those that are external. And the easiest way to do that would be to put any creams or lotions or things like that that are externally used, just put them in a baggie, and that will generally keep them. I've seen people give lotions like they were cough syrups, so people can do some odd things. So keep those things separated. And then always, as I said, keep medications in the original container that comes from the pharmacy. Never put them into any other container. The pharmacist can put medications in bubble packs for you. Pharmacists can give you another labeled container if you wanted to send a fewer medications to some place that the person is going or whatever, but it has to remain in packaging that is labeled appropriately according to Board of Pharmacy regulations. Now, can you use med packs that you buy? Yes, if somebody helps. We have some consumers that have some compliance aids where medications are put in there, but that you have to be very careful. You don't put all their meds in there with that. So again, medications have to be labeled properly. We've gone through that. Now, what about getting rid of expired medications? Again, there's a number of ways to do this. But what you don't do is you don't pour them down the sink and you don't put them in the toilet, which used to be how everybody threw them away. Today, you have several options. One is that there are pharmacies. I've listed Walgreens, but there are a number of pharmacies now that have these take-back programs where you can bring old medications in, and they go into a container where they're going to be destroyed. So you might want to ask your pharmacy if they have that service. I know for certain Walgreens does, but I'm sure that there's also some others. Now, another thing that you can do, and you might think this sounds strange, but you can go to the FDA or EPA website, And you can find that if you have medications that you need to get rid of, they've expired or you're no longer taking, you can take a bag of used coffee grounds, or you can take a bag of kitty litter, and you can put those things in there and kind of crush them up. And you can actually then throw that into the trash. I usually recommend damp coffee grounds, because then those things will dissolve and they won't be able to be taken by anybody, but making them wet is not essential. You can even use dirt, by the way, a baggie full of dirt to throw this stuff away. And that is actually legal. Doesn't sound like it would be, but it is. Okay. For narcotics, like let's say Vicodin and Norco, those kind of things, the DEA will have take-back days. Those are usually advertised well in advance. Some pharmacies are now doing take-backs on controlled substances, so you can get rid of those things easily. We recommend that you not keep old controlled substances around in your facility or in your own personal home, because it's one of the ways that some people have been exposed to prescription narcotics and then ended up having trouble with it. And I can tell you that in my own home, someone tried to pilfer some post-op Vicodin that we had in our medicine cabinet. So it's actually happened to me. So we recommend that you don't, keep those things around, that you get rid of them, either through a DEA take-back or one of these take-back programs at a pharmacy. Now, when you destroy a consumer's medications, you need to record that. There needs to be a destruction and disposal log at your facility, so that you're recording, when and how and what was gotten rid of, and those kinds of things. So that's the end of part 1. Next week, we'll do part 2, we'll kind of pick up where we left off. So I'm going to back out of here, and I'm going to ask if anyone has any questions for me.
And you can write questions in the Q&A if you have a question.
Another thing you can do, if you guys ever have questions, you need some help, you can find me at pharmacist@vmrc.net, and I will answer questions if you have any there. I sent Vicki the quiz, so always remember, if you want credit for this, what you do is, Vicki, you're going to get the emails, right? Not Lorraine.
Correct. Yeah. vfisher@vmrc.net.
Yeah, and then Vicki will send you a copy of the quiz, and you can take it. You can get the answers back to her in any way you want. You can scan it and send it back. You can tell her the answers to number 1, 2, 3, etc. And then she will get you your certificate of completion.
And just a reminder that we'll be doing Med Basics 2 again next Thursday at 2 p.m.
Right.
And you can register like you did before from our website, or just let me know and I'll send you the link.
Yep. And this is also being recorded, so that if you decide, at your facility that you want to do it with a bunch of people at a different time than when I'm doing it, it's available and you can still get credit for it. Okay, since I don't see any questions, I'm going to go ahead and say, everybody have a good afternoon. I think I'm about done.
All right. Thank you, Dr. Kehoe.
Okay, we'll see you all later.
All right. Bye-bye.
Bye.